Hi everyone. So before we start our discussion today, I want you to watch these two videos with me. So the first one is here. Did you just watch that video with me? I believe you did. Unfortunately, it's very unfortunate. We have been trained to call this palliative. We have been told to see it as kind benevolence. But a bag of rice shared before the election isn't just a gift. It's a trade. It's trading your future for a temporary meal, which masks deep systemic governance failures under the guise of giving out charity to the citizens. Now, look at this video. Look at it. Let's watch it together. I believe you were intrigued watching that video with me. Yes, that is what actual governance looks like. Good governance, an air ambulance, an advanced medical infrastructure, a system built on the belief that every single second of a human life is worth fighting for. The difference between these two videos isn't just wealth, it's priority. Do you know that some cancers are best treated if they are seen and visualized on imaging machines such as CT scans and MRIs? I will call the MRI machine an indispensable eye. You may be surprised why I refer to this as an indispensable eye. Because it allows medical practitioners to look deep inside, mapping out abnormalities and catching aggressive tumors long before they spread to every part of your body. And do you know that Nigeria, I mean the entire 36 states, have only 58 functional MRI machine, serving a citizen of over 220 million people. Imagine the shock. It shocked you. That's why it shocked me as well. That means over 3 million people to just one MRI, which might not be available in your state or even somewhere close to you. Let me even shock you more. MRI scans in Nigeria typically cost between 120,000 to 350,000, depending on the body parts you are imaging or the city where you live, or whether you need contrast for this image or not. Looking at this data I just gave you, how many people can afford to pay this amount for an investigation? For example, prostate cancer. Studies have shown that using MRI scans early can reduce prostate cancer death rate by nearly 20%. It prevents blind biopsies and avoids unnecessary pain and gives fathers, our brothers, our sons a 99% chance of survival. I saw a video about someone decrying the rate at which a lot of men are having urinary catheter. Most of these men are just dealing with enlarged prostate, which, if the government has provided the right medical infrastructure to help tackle this, these men would have better quality of life without having to carry urinary catheter for the rest of their lives. Ventilators, defibrillators, ECGs, keeps hope alive for a long time. So, my fellow compatriots, demand more than just stomach infrastructure from your politicians. Demand the tools that save our lives and preserve our next generation yet unborn. I hope that has opened our eyes to the realities of what we are facing, of what Nigerians are facing, and of what is applicable for people living outside Nigeria to access adequate medical care. So please, let's look at these realities and make decisions that will save our generations yet to come. And let's stop settling for stomach infrastructures. So continue my discussion about the treatment options for an enlarged prostate. If you are here to watch my last video where I talked about lifestyle management to help manage your symptoms as a man living with an enlarged prostate, go and catch up on it and familiarize yourself with these tips. So the next treatment option I will be discussing with you today on the treatment options of an enlarged prostate is treatment with medications. But I will be using an illustration to describe this. I'll be using the garden hose illustration to describe this on how these medications work to help with the treatment of enlarged prostate. I will be using this garden hose as an illustration to describe how the medication that helps to treat an enlarged prostate works. So imagine your bladder is the tap or the reservoir that is connected to this tube. And the tube that you use to pass urine, that is the urethra, is this tube. Your urethra is standing for this garden hose I am holding. And you remember the urethra passes through the prostate. And your prostate is going to serve as my grip. That is my hand that is gripping the garden hose at the moment. So this is your urethra and this is your prostate. So in a young man, the hose is wide open. Can you see? This is wide open and it opens very fast and the pressure is high. But as men grow older, the gland, that is my fist, surrounding the tube, that is the prostate, they begin to grow bigger. And it's like you holding a fist, wrapping around the tube at the moment. You see that I'm squeezing the tube tight? Yes. So when you are squeezing the tube tight, it restricts pressure of water coming out of this tube. And suddenly, when you want to empty your bladder, it's very difficult for you to empty your bladder because of the fact that there is a pressure holding onto the tube. That is, your prostate is enlarged, which is my fist over the tube at the moment, and it's serving as a pressure holding onto your urethra, thereby restricting the flow of urine out of your bladder. So suddenly, passing urine feels like trying to empty a pool through a straw. How possible is that? I don't think that is possible. So when you go to the hospital to get your enlarged prostate treated, there are two different ways that the doctors can fix this problem for you using medication. The first medication I'll be talking about today is what I call the quick relaxer. You're surprised how that works. So the quick relaxer works this way. Can you see my hand as I am tightening the grip on this garden hose? So the water starts to flow immediately and even faster. Because how the medicine works is by loosening my grip on this hose. It acts by telling the smooth muscles of your prostate. That is, your prostate stands for my fist right on the hose at the moment, and it tells your prostate to loosen the grip on this garden hose, so thereby relaxing the smooth muscles of the prostate. This doesn't shrink the prostate, but it forces the tight grip to loosen up within just a couple of days. So you see this tight grip, suddenly it starts to loosen up gradually, and the flow is better and the flow increases. by relaxing the muscle fibers in the prostate and the neck of the bladder. The pressure on this pulse, can you see how fast this water is gushing out? Yes, so that is how the medication acts. By relaxing and releasing my grip on this pulse, increasing the pressure of your urine from your bladder, and the fluid can then flow freely like River Niger and Benue. It is quick, effective, and an easy way to treat an enlarged prostate. That is the muscle relaxer. I call it the quick relaxer medication. The second medication that helps to treat enlarged prostate is called the shrinker. How does this medication work? This medication works by helping to loosen the fist that can hold the grip on the garden hose I just described. That is where this type of medication comes in. This medicine goes after the roots and cause of this enlarged prostate. That is the hormones feeding the growth of the prostate gland. It blocks the specific hormonal signals that tells the gland to keep expanding like Nigerian landlord. And over months, this medication helps to actually shrink and reduces the size of the prostate. It works by slowly thinning out the fist, that is the prostate, holding your urethra and permanently taking out the pressure that this fist is putting on your urethra. However, sometimes we would even combine these two medications together to give you a fast relief by relaxing the squeeze today. That is the squeeze the fist is producing, putting on your urethra, and the other to shrink the tissue that is actually causing the enlargement of the prostate. However, even though this medication helps to manage your enlarged prostate, every medication carries a balance of both benefits and potential trade-offs, because this type of two medications works on two different systems on your body. One on your muscles and the blood pressure, and the other one works on your hormones. They come with different side effects. The quick relaxer, since this medication relaxes the smooth muscles, that is including those muscles within your blood vessels, they can sometimes lower your blood pressure, which could lead to these most common side effects such as dizziness and lightheadedness. This is noticeable when you want to stand up quickly. This leads to a temporary drop in your blood pressure, and this is caused by change in position. We call this, the medical term for this is postural hypotension. However, we usually advise people on this medication to avoid standing up just too quickly to prevent this sudden drop in blood pressure. Another side effect that you could see as someone taking this medication that helps to relax the muscle of your prostate is nasal congestion. Because these drugs relaxes blood vessels, they can also cause mild swelling in the tissue of your nose, leading to you having stuffy nose or symptoms similar to someone having cold or catarrh. Another symptoms that you could notice while taking this medication is just tiredness, fatigue. You might feel a bit more tired than usual. During the first few weeks, as your body just adjusts to the changes, how your blood vessels react to this medication can cause you to have sudden symptoms of feeling weak and tired. So these are some of the side effects that you could have taking that medication. And the last side effect I'm going to be talking about today on medication that helps to relax the muscle is the ejaculatory changes. Yes. So the most specific side effect for this is what we call retrograde ejaculation. You think I'm speaking a big English? No. So this is what happens when the muscle at the neck of the bladder, which usually closes when you want to ejaculate, that when you are doing the do and you are about to expel. Yes, so the muscle at the neck of your bladder closes. So however, because of this effects of this medication, the muscle at the neck of your bladder stays too relaxed, and as a result, semen may travel backward into the bladder instead of exiting the body through the normal route. However, this is not harmful at all. This can be noticeable, and this could be as a result of you taking the medication that helps to relax the smooth muscle in your prostate. The second medication, which is the shrinker. Because the medication alters the way your body processes specific hormones that drive prostate growth, their side effects are largely attributed to hormonal changes such as reduced sexual libido. And that is the most commonly reported issue for people that are taking this medication that helps to shrink the prostate gland, and by therefore reducing the size of the prostate gland by acting on the hormone that facilitates the growth of the prostate gland. They also complain of difficulty achieving or maintaining an erection. So those are one of the side effects you could have as a result of taking that medication. The second most common reported side effect is breast tissue changes. I know you say men don't grow breasts. Yes, because this medication acts as hormone blocker. That is, they act on the hormones in the body. So in rare cases, some men experiences breast tenderness, and some men notice that they start to grow breasts just like women as a result of taking that medication. The next side effect that you could notice as a result of taking this medication that shrinks the prostate is mood changes. Some men report feeling of depression or anxiety while taking this medication. So the final thing I will be saying to you today is that it is normal for your body to need a few weeks to adjust to new medications. However, if you have any of the following symptoms after the commencement of any of the two medications, you need to speak urgently to an healthcare provider because they are severe signs. And number one is severe dizziness or fainting. So if you feel you are having severe dizziness, or you feel you want to faint, or you are fainted after you have commence this medication, you need to speak to an healthcare provider urgently. Another red flag that you should take note of if you're on any of these two medications is what we call health-related symptoms, palpitation. That is, you feel like your chest or your heart is racing, as if your heart is running a race. And sometimes some people could have chest pain. If you have any of those symptoms, please speak urgently to an healthcare provider. Also, if you notice irregular heartbeat, you notice your heart is skipping some beats, another red flag to take note of and speak up as soon as you notice is persistent sexual dysfunction, that is erectile dysfunction. You notice that your staff of office functions normally before taking that medication, but after the commencement of the medication, there is reduced function to your staff of office. Then you need to speak to your healthcare provider. Either they are going to stop the medication or maybe reduce the dose you are taking. Another red flag that it's important you report immediately you notice is significant mood changes or persistent feeling of sadness or anxiety that may lead to depression. Please speak up and go and visit the nearest hospital if you have that symptoms as soon as you start that medication that helps to shrink your prostate. So we can see that whatever has a good effect also has side effects. However, there are new evidence-based surgical interventions that could help you manage your symptoms as a man living with an enlarged prostate. And these surgical interventions give minimal side effects. So I will talk about these interventions in the next episode and signpost you to where you could get these treatments around you. Thank you, and don't forget to follow, subscribe, share this with men around you. I remain Sinat, your favorite educative urology nurse practitioner. Bye. See you on our next episode.